Hi, my name is Crochet LeBlanc, and today I will be presenting about the highly infectious disease known as syphilis. This is for my microbiology course for 2021. So this is a quick overview of the disease itself. It is, like I said, is an infectious disease. It causes various symptoms, mostly on the skin and on the mucous membrane, but primarily on the skin is really where most of these symptoms manifest. It is caused by a bacteria known as Treponema pallidum, and it is usually transmitted by sex. Sexual activity, although sometimes it can be transmitted from mother to fetus. The main diagnostic methods are blood test and dog field microscope with an infected fluid. The best prevention to date would be abstinence, which is complete refrain from any sexual activity. But the next best thing would be a use of a latex condom as recommended by the CDC. The best known treatment to date is antibiotics, although no vaccine are available to date, but antibiotics do a pretty good job at eradicating the virus itself. It's very frequent, affecting mostly 45.5 million of the population as in 2015 and causing 107,000 deaths as of 2015. Bacteriology, like I've said, it comes from a bacteria known as Treponema pallidum, which is a spiral-shaped gram-negative and highly mobile bacterium. It is really, humans are the best known reservoir for the pallidum subspecies, and the reason why is because it is unable to survive outside of a host. So that's why sexual transmitted ways is the best, most common way of acquiring the disease, because it cannot simply live on any surface. It needs a host to survive. Introduction. Really, the best thing we can take away from this slide is that syphilis was discovered by Shadeen Hoffman in 1905, and it does affect most organs, especially in its late end stage. And it also, and it's the one thing that is very different with about syphilis than most other diseases is that in its late end stage, it becomes asymptomatic. So it really doesn't show a lot of symptoms in some of its late end stage as most other diseases, because most diseases tend to get really worse as they progresses. Like I've said, the infection itself primarily triggers an immune response with T cell, plasma cell, and macrophages, and it really manifests itself with chancres and rashes. Penetration. The bacterium T. pallidum enters the body via skin and mucous membranes through abrasion during sexual contacts. That's why, and also, like I've said, it is also transmissible from mother to fetus. It travels in the lymphatic system to regional lymph nodes, and then travels throughout the body via the bloodstream. It invades the central nervous system in its late stage of disease. These are some worldwide data of how syphilis have affected population all around the world. In the United States, in 2007, the rate of syphilis was 6 times greater in men than in women, and untreated syphilis had a mortality rate of 58% with a greater death rate in males. These are 4 different stages of syphilis: primary, secondary, latent, stationary, and tertiary. How those stages differentiate is really the timing and the features exhibited by each one of the stage. The timing vary from primary from 3 to 4 weeks after exposure, although tertiary from 1 to 10 years after infection. And although the features are very common, at the primary difference is that at the latent stage, it's asymptomatic. Which is very interesting when I was doing the research about this disease, because it does exhibit different features like painless chancre at the equilateral site and at the inoculation site at the primary stage. At the secondary stage, there's some rash and there's some common symptoms that exhibit itself. But once you get to the latent stage, it's asymptomatic. That is one thing that I wanted to point out with this disease. Syphilis is referred to as the great imitator by the scientist William Osler. And the reason why is because its ability to present itself in varied way. The presentation of syphilis varied from host to host. From person to person, two people might be dealing with the same phase of syphilis, yet exhibiting completely different symptoms, which is interesting about the virus. Okay, so let's talk about the primary stage of syphilis. Like I've said, it is transmitted by sexual contact, and the way it exhibits itself is really 2 to 6 weeks after initial infection, and is really the primary symptoms is in lesions on genital area mostly. So here we are seeing a male genital area, and we are seeing the lesion on the tip and around his private part. Secondary syphilis occurs 4 to 10 weeks after primary infection, and it is really known to, that's where it really differentiates from people to people, which is one of the reasons why it is called a great imitator, because two people might be encountering the same stage of syphilis, yet exhibiting completely different symptoms. But most likely the symptoms will occur in the skin, the mucous membrane, and the lymph nodes. The latent stage of syphilis is described as having serological proof of infection. That means without symptoms of the disease. After the secondary stage of syphilis, it really gets divided into 2 stages: the early latent stage and in the late latent stage. The early latent stage is defined by the World Health Organization as of 2 years after initial infection. Tertiary stage syphilis. Tertiary stage syphilis occurs 3 to 15 years after initial infection, and it comes in 3 forms: gummatous syphilis, late neurosyphilis, and cardiovascular syphilis. Gummatous syphilis or late benign syphilis, it occurs from 1 to 46 years after initial infection, with an average of 15 years. This stage is really characterized by chronic gomas on the skin. Neurosyphilis refers to an infection involving the central nervous system, and it infects, and that really cannot occur at any stage of disease, although very rare at the early stage of the disease, but it can happen. Cardiovascular syphilis occurs 10 to 30 years after the initial infection. The most common complication is really syphilitic aortis, which may result in aortic aneurysm formation. Neurosyphilis. There are mostly 2 it develops decades after the initial infection, and there are 2 main types: general paresis and tabes dorsalis. General paresis presents itself in different ways, mainly dementia, personality changes, delusions, seizures, psychosis, and depression. Tabes dorsalis characterizes itself by gait instability, sharp pain in the trunks and in the limbs. Diagnosis. Syphilis is really diagnosed via blood tests, like I mentioned before, and also it can be diagnosed using a dark field microscope with infected fluid. Blood tests are most commonly used because they are a bit easier to perform, although diagnostic tests are unable to distinguish between the stage of the disease. So that is mostly rely on the symptoms that is being shown on the host. Treatments. There's different type of treatments for syphilis, but they are all antibiotics in the early stages of syphilis. The line of treatment is very simple. It consists of a single dose of intramuscular benzylpenicillin. If in a case where a person is allergic to penicillin, they can be administered with doxycycline or tetracycline as an alternate choice. In late infection for neurosyphilis, due to the poor penetration of benzathine penicillin into the central nervous system, those affected with latent infection are given a general large dose of intravenous penicillin G for a minimum of 10 days. Okay, so this concludes my presentation, and I created a very fun multiple choice question that I think if you were paying attention would be a very fun way of interacting and be able to test yourself perhaps. So the question goes as follow. Syphilis is often called what? Choice A, the great terminator. Choice B, the invisible dictator. Choice C, the great imitator. Choice D, terrorizing emperor. What do you think? Okay, the correct answer is the great imitator because it was described as such because of its ability to present itself in various ways from host to host, meaning that two people can be undergoing, let's say, secondary stage of syphilis, yet exhibiting completely different symptoms. Whereas one person might get might be as far as having the disease itself affect their central nervous system, while the next person might just be exhibiting very, very mild rash. So it really varies from host to host. And these are some references. I utilize some books, some articles, and some journals to aid me in conducting my research for this subject, which I really had fun doing. Thank you very much for sitting through this presentation. I hope you enjoyed it. Thank you very much.